Hello everyone, and welcome to this webinar on mindfulness for stress and anxiety reduction during COVID-19. I'm Alana from the Alumni Engagement Office at the Faculty of Medicine, Nursing and Health Sciences at Monash University. I'd like to begin by acknowledging the traditional owners of the lands on which we meet today and pay my respects to elders past, present and emerging. Thank you for joining us for our first virtual event for the Monash Medicine, Nursing and Health Sciences alumni community. We've been delighted by the interest in this event, with alumni joining us live from all over the world on Zoom and YouTube. We are grateful for all the work you do across the healthcare professions. In these challenging and uncertain times, we hope this session will be of great benefit and value. We are honoured to have our very own internationally recognised mindfulness expert, Associate Professor Craig Hassett, as our guest speaker. As you can see, Craig has an extensive biography. He's been working with the faculty since 1989. He now teaches into other faculties too and is coordinator of mindfulness programs across Monash. Craig developed and integrated into the Monash medical curriculum the world's first mindfulness-based healthy lifestyle course. In 2019, he was awarded the Medal of the Order of Australia for services to medicine. Craig will present on how mindfulness can assist in these uncertain times and facilitate some short activities. We will then move into a Q&A session. Please submit your questions throughout the session, and thank you for those we've already received on registration. We will answer as many questions as we can in the time available. Before we begin, we have a few tips and suggestions to get the most from this session. For those on Zoom, please use the central top view option function to select side-by-side view. You can submit questions using the Q&A feature on the bottom of the screen. For those on YouTube, you can submit questions using the live chat function. I'll now pass over to Craig to begin the workshop. Thanks, Craig.
Thank you very much, Eleanor. It's great to be with everybody now and to be exploring how mindfulness could be helpful for us personally, but also professionally as well. We were just chatting before I started working at Monash. It's my 32nd year now at Monash, and I really have always found it a wonderful place to work and very innovative. And I think that the introduction of mindfulness, we're the first university in the world to introduce it as a part of core curriculum into a medical course. I think it's just a sign of the innovation that Monash has, it's always been a part of the culture. So I'm going to try and give you a bit of an overview of why you should be interested in mindfulness and some of the tips on how to use it, and perhaps at the end where you can find out more about it if it's of interest to you. Now, obviously I've been at university for far too long, so I'm going to give you a bit of an entrance exam now, all right? So start off with a multiple choice question for you, all right? So you need to get these questions right, or we might have to delete you from the panel. But anyway, who has the longer attention span? Is it A, humans, or B, goldfish? Now, I'll just give you a moment or two to reflect on that. Okay, now, if you're not sure, the answer is goldfish. Okay, well, at least according to Microsoft. And so this is a Microsoft report just noting that the average human being has a shorter attention span than a goldfish these days. So, and as the CEO said, the true scarce commodity is increasingly human attention. So are we becoming a more distracted and distractible culture? So just another little piece of information as well. This is a paper just reviewing the effects that the online world is having on the human brain these days. And mind you, in this COVID-19 world, we're probably spending a little bit more time online than we would have liked. But mind you, the technology has been fantastic for helping to bridge the gap when we can't sort of connect in the usual ways. But the online world, if it's misused or overused, has effects on the human brain, particularly in areas related to attention. So the attentional circuits in the human brain for many people these days are not functioning so well because the kind of overload of how many things we've got coming at us. Areas of the brain associated with memory, because we don't have to remember anything anymore like we perhaps used to. We just need to know where to find the information. So we're not using our memory circuits in the way that we might have once. And so those areas of the brain are wasting away to some extent. And areas of the brain associated with social and emotional intelligence. because of the overdependence for many people on social media. So anyway, a more distracted world in many ways. Another multiple choice question for you. What did the Thai boys soccer team have that helped them to cope with being trapped in a cave for nearly 2 weeks? Was it A, 20 packets of Valium? Was it B, free Wi-Fi? Was it C, 70-inch flat screen TV and a box set of Game of Thrones? Was it D, a coach as a meditation teacher? I'll just give you a moment to reflect on your answer for that one. All right, so if you're not sure, it was free Wi-Fi. No, I'm actually joking. It was D. And I don't know if you followed the story at all, but I was really struck when they actually found the boys in the cave, how cool, calm, and collected those boys were, how they were coping incredibly well. And they got out of that situation, but when they interviewed them a few weeks later and let them speak to the press, none of the boys talked about how traumatized they were by the experience. They all talked about how they grew, how they became stronger, how they learned a lot about themselves, and came to light that the coach had practiced and taught quite a lot of meditation. And so he took the boys through that, so they learned that skill, and no doubt helped them to remain grounded in that really extraordinarily difficult time. So the boys' resilience was quite something remarkable. Just another little point, just to set a context as to why there's a lot of interest in mindfulness these days. This is data from a paper that was looking at what are expected to be the developed world's 10 top burdens of disease by the year 2030. Now, by that stage, that's how far ahead depression's expected to be as the #1 burden of disease. It's already overtaken heart disease, but this has been a trend that's been going on for a few decades. Then you've got dementia, alcohol abuse, diabetes, etc. So collectively, our mental health has been going in the wrong direction for a long time. So clearly, anything that helps to prevent depression or the relapse of depression is going to be very big news in healthcare. All right, now, and of course, this should be of considerable interest to us. This is just some data looking at levels of burnout and psychiatric morbidity in new medical graduates. So this was a study of New South Wales interns, a paper from the Medical Journal of Australia. It's the only study of its type that actually followed what goes on in the first year of working life for new medical graduates. It'd be interesting to see similar kinds of studies for physio graduates and nursing graduates, etc., because I don't think we'd have this to ourselves. But every 3 months, I looked at rates of burnout and mental illness. Now, so what they found was by 8 months of their first year of working life, 75% of interns qualified as having burnout using Maslach's burnout inventory. 73% qualified as having had a mental illness on at least one occasion in the first year of working life. Now, one of the things that this says to me about how we train health professionals to do a demanding job is that we're missing out some really important parts of training. And of course, these were not Monash graduates, because if they were Monash graduates, it'd be totally different, because we teach our Monash graduates about the importance of self-care. But this is a deficiency in training health professionals, I think, that we focus on the technical skills and knowledge, the biomedical knowledge that we need, which is all really, really important, but we ignore their skills in how to personally manage those kinds of demands of really complex environments. Now, this matters, the well-being of our health professionals matters for its own sake, but it also matters because it affects how we function. So this is a BMJ study looking at 3 US hospitals, and they found that 20% of the resident medical staff qualified as having depression at any given time. And they found that depressed doctors made more than 6 times as many medication and prescribing errors as non-depressed doctors doing the same job. And so our self-care really matters because it's an investment in the well-being of the people we're trying to look after. And of course, if the attention's not on the job, if we're depressed and going around, doing a very complex job in our day-to-day life, then what is the attention on? So this is all just to set a bit of a context. So, and just the last little thing, this is a study from Harvard, and this was the concluding statement in this particular study. In conclusion, a human mind is a wandering mind, all right? So, and I don't know if you at home have got a wandering mind, a mind that kind of tends to wander off. You're there and you could be listening to a talk on a webinar, or you're sitting down and a patient speaking to you, and all of a sudden you realize you haven't heard a word of what they've been saying for the last 5 minutes. Has that ever happened to you? Because if you're not nodding right now, it's probably happening to you now because you weren't listening to the question I just asked. But you've got a mind that wanders off. You could even be reading a book on mindfulness and you're halfway through a chapter and then realize you're not taking in a word of what you're reading. So this wandering mind. But the point is, and a wandering mind is an unhappy mind. The ability to think about what is not happening is a cognitive achievement. So an achievement in thinking that comes at an emotional cost. So what is it about this wandering, distracted, inattentive, disengaged mind? How does it affect how we feel, how we function, our physical health? Because when the mind's wandering, maybe that's when it's most vulnerable to wandering into worry and rumination and all of the rest. So now there is a term that's given to the wandering mind, and it's called default mode. So that's the distracted, inattentive, and disengaged state of mind. So if the patient's speaking and you're not listening, or your partner's speaking and you're not listening, you're probably in default mode. And when we're in default mode, we're thinking about the past, reliving things that have happened earlier in the day, or our mind's wandered off into the future. Well, what about this and what about that? And I've got so many things to do, so many deadlines. And so the areas of blue are the areas affected by default mode, and they include the areas associated with our executive function. So they're pretty much offline when we're not focused and present and on task and attentive. Just in case you're interested, the areas of red are the areas affected by Alzheimer's disease. But the more time we spend in default mode, the more the brain gets gummed up with beta amyloid, which leads on to Alzheimer's disease. It's not a particularly useful state of the brain to be in. Now, there's a lot of default mental activity in states like anxiety and depression, etc. We give it names like worry, rumination, catastrophizing, negative self-talk, but it's pretty much what it means not to be mindful. So anyway, I just came across this recently. If you can't go outside, then go inside. All right. So in many ways, mindfulness is a kind of a going inside, and especially in these times when we can't go outside. Now, so these days, people think of mindfulness as a bit of a revolution. It's a bit of a new thing. It's a bit of a fad, but it's certainly not a new idea. Even at the birth of what we call modern psychology, and William James pretty much laid the foundations for it. This is what he wrote back in 1890. The faculty of voluntarily bringing back a wandering attention over and over again is the very root of judgment, character, and will. No one is compos sui, and that's Latin for a master of themselves. So no one's a master of themselves if you have it not. An education which should improve this faculty would be the education par excellence, the best of all educations. But it is easier to define this ideal than to give practical instructions for bringing it about. Well, these days we can give a few practical instructions. Just in case you're interested, this is a graph looking at the number of peer-reviewed journal articles listed on PubMed on mindfulness each year. I think you can notice a bit of a growth there. 2019, there were 1,449 new papers published last year. By the end of this year, there'll probably be close to about 1,800. It started to take off in 1999 when the very, very first studies on mindfulness to prevent the relapse of depression were being published. And that created a lot of interest. And then those studies started to come out, and studies on the brain and studies on improved memory and executive functioning, and then studies on a whole variety of things started to come out. And all of these areas are expanding at once, leading to this exponential growth. So you'd have to say there's a lot out there, but if you are interested, PubMed's a really good source of information to see what are the current studies, what do the reviews say, etc. So just in practical terms, what does it mean to be mindful? Well, being mindful is a really simple thing. Like I go for a run most mornings, stepped out of the door, it was dark this morning, just the very first light was coming on. There's this really dark clouds just on the horizon from the storms that had passed over, a beautiful crescent moon in this clear sky that, that was left behind. Just moments of being present and taking in the scene. We have mindful moments every day. And you probably do things in your day-to-day life to help you to de-stress. It could be the sport you play, it could be the music you play, some other interest or hobby. But if you consider the state of mind you cultivate when you're doing those things, you may not think of it as mindfulness, but you probably are practicing mindfulness already. That is, you stop thinking about all the other stuff you've got to do and this and that and the other thing, and you really immerse yourself in the thing that you're doing. How do you feel at the end? Oh, my head's clear, I'm relaxed again, etc. Well, that's a product of being mindful while we do those things. I was running a program from psychology students recently. One of the psychology students said, oh, I don't practice mindfulness. And I said, well, but what do you do in your leisure time? I said, oh, skateboarding, that's my thing. I said, good. Where's your attention when you're on your skateboard? And these were the words he used. Oh, well, if your mind is somewhere else, you can't do the tricks. Great. Well, how do you feel when you get off your skateboard? He said, I feel great. I'm alive. I'm invigorated. You know, I'm ready to get on with stuff. But he's actually cultivating a mindful state of mind while he's doing that. I don't know if any of you enjoy wine, but if you do enjoy wine, you'll be happy to know that wine tasting is a mindfulness practice. All right. Now, probably just the fact that I've mentioned that, it probably means half of you are ready to start practicing mindfulness immediately. All right. But what I mean by that is you engage every one of your senses in the experience of tasting and savoring the wine, like the guy on the left there, practicing mindfulness over a glass of wine. Now, some of you probably noticed that the other two are pretty mindful as well. They're not quite so mindful of the wine, but anyway, I think the guy on the left needs not just focused attention, he needs a little bit more situational awareness as well. But anyway, when we do things with attention, one other big reason to be mindful as well, this is a pretty good reason to be in the present moment, I would say. This is the famous Australian surfer Mick Fanning, which we'll just go back to that for a moment. This has happened a few years ago in South Africa. It was live on television, a surfing final. Shark comes up. Luckily, it got the leg strap and missed his leg, and it came back at him a couple of times. He was punching the shark. He was getting his board between him and the shark. Got out of the water when the jet ski got to him, unscathed, goes in. First question, what happened, Mick? And this was in the press conference. And he said, I just went into fight or flight. Now, I don't have time to go into all the nitty-gritty of the fight or flight response, but I just want to make the point that it's being activated based on being mindful. Being mindful doesn't necessarily always mean just sitting back and putting your feet up. Being mindful in a situation like this means activation, like a car going into turbocharge. And the fight or flight response is not an anxiety response, it's an activation response. And the little turbocharge button in the brain called the amygdala is firing off. And this, if we're lucky, is the difference between life and death. So the stress response is meant to be good for our health, not bad for our health, if we're in the water with a 4-meter shark. Now, you probably thought the stress response is meant to be bad for health. So maybe there are times we activate it when we don't really need it. Now, I don't know whether any of you have ever gotten anxious before a future event. Or, you know, I don't know, it could be thinking you got to speak in public, or it could be got an exam coming up, or it could be you open your appointment book in the morning and, you know, stress response activates. Or maybe you get stressed and angry over things that have happened in the past. Now, the question is, in this situation with Mick Fanning, you can point to the fin in the water and say, well, there's the stressor. There's the trigger for the stress response, like it's a fin attached to a 4-meter shark. But in these other situations before or after an event's even happened, where is the stressor? And if you reflect for a moment, you'll notice, oh, the stressor's in the mind. Like you could even be awake at 3 in the morning. I don't know if you've ever been awake at 3 in the morning. And not only awake, but stressed and hassled and under the pump. And just consider what life is throwing at you at 3 in the morning. Chances are that it's a soft mattress, a soft pillow, a warm doona, and a quiet room. Life cannot get any more comfortable than that, surely. So there's present moment reality, as comfortable as life can get, and yet in our mind, we could be in a world of pain. We might mentally do 100 days work in our head before we even get out of bed. Now, that would be a really good thing to do if we got to work in the morning and you get there and somebody says, oh, all your work's been done. You say, yes, that's because I thought about it all night. Fantastic. Well, why don't you have the day off? Great, I'll do that. You know, it doesn't work like that. So all of that, you know, mentally going over the future or dredging up the past, 99.999% of the times we activate this stress response, it's got nothing to do with present moment reality. It's got everything to do with an imagination taken to be real. And when we're not mindful, the mind not only projects its own little world, you know, in the future or the past, but we also take that to be real. Because if I invited you right now to imagine a tiger for me, so could you imagine a tiger? Okay. Now, are you actually afraid that that tiger is going to eat you? Probably not. Why? Because you know the tiger is just imaginary. Well, the next time we're catastrophizing over some hypothetical thing in the future or reliving something from the past, do we also realize that that too is in our imagination? Because you might just be standing at your kitchen bench, just jiggling a tea bag and a teacup. So what does it mean to be mindful there? It means to come back to reality, come back to where you are. Now, mind you, if you're planning for a future event, preparing for an exam or preparing for a presentation or something else, then you do get your attention back on task, but the attention unhooks from worry about the task. And one of the things about worry that's associated so much with anxiety and stress and so on is that worry does lots of good impersonations. For example, it impersonates planning and preparation. We think we're planning and preparing when we're actually just worrying. The two things are very different, because if you are focused and on task and planning and preparing, you'll just feel productive. Your attention will be on task, your mind will be working well. When we're thinking we're planning and preparing, when we're just worrying, or when we're ruminating, etc., we feel awful. Physically, we'll notice it, the fight or flight's activated, but we'll also be not functioning very well. Now, allostatic load is the name given to the wear and tear we put on our system of overactivating this response way in excess of what's required. And again, I don't have time to go into all the details, but we get impaired immunity. So during periods of high stress, we're more likely to come down with infections and coughs and colds. Not a great thing in COVID-19 world, of course. If we get one, it'll be more severe. It accelerates atherosclerosis, metabolic syndrome, bone demineralization, we also know as osteoporosis because of the high cortisol. Anyway, we get atrophy of brain cells too. And two areas are particularly sensitive day in, day out to these stress chemicals: the hippocampus and the prefrontal cortex. So learning and memory, working memory, executive functioning circuits. They're not areas of the brain we want damaged in this way. But the only bit of the brain to grow, if it's being activated all the time, is the amygdala. And that's the brain stress center. So it gets bigger and more reactive. Now, just another interesting little study. Now, the question is, well, in this study, they wanted to know whether people who had a tendency to produce a lot of cortisol, a lot of stress chemicals when they're put under a pressure situation, if you put them under that situation again and again, would they even pump out more cortisol the next time, more the next time in anticipation? Or if you gave people skills on how to manage their attention, stay present, how to ride those waves of anxiety and stress more easily, would the same thing happen to them? So they got a bunch of people with a lot of cortisol when they're put under stress, and they put them in two groups. One group, they just stressed them out 3 times. The other group, they stressed them out, and then they gave them some training and stressed them out a couple more times. These were actually female teachers, and there was public speaking and having to perform maths tasks, etc. And they were really being put under the pump by these critical evaluators. Now, what the control group, who did not have the training, showed is every time they put in that same situation, they pumped even more cortisol out than the time before. So they're getting more and more stressed over the same thing. And not just stressed while they're doing it, stressed in the lead up to it. Oh, it's coming up again. It's going to be awful. It was horrible last time. But for the group that had this training, their trend was towards less and less cortisol every time. So they were able to stay more grounded, stay more present. Yeah, there's that wave of anxiety. It's okay. Don't have to fight it, but just learning not to get so caught up in it. These are very important skills to learn. Stress and telomere shortening. Telomeres, some of you might be familiar with telomeres, but the first Australian woman to win a Nobel Prize was Elizabeth Blackburn, and she won the Nobel Prize for discovering telomeres, and in 2009 she got the prize for that. And they're the little caps on the end of your chromosomes that stop your DNA from unraveling, like the little plastic bits on the end of shoelaces stop shoelaces from unraveling. And the telomeres are at their longest and healthiest when we're born, but after we're born, they get whittled away shorter and shorter, and the ends of the DNA get frayed and start to unravel and mutate. And the shorter the telomeres, essentially the older we are and the bigger the risk of the illnesses we associate with aging. So Elizabeth Blackburn works with psychologist Elisa Epel, and they're interested to see, well, does stress accelerate aging on a molecular level down to the DNA of our cells? So they were looking at healthy premenopausal in this first study they did. These were actually carers. So these were mothers of children with a major chronic illness. And what they found was that the women in the third who were coping least well compared to the third who were coping best emotionally were about 9 to 17 years older as far as their telomeres were concerned. and a lot of implications, of course, for aging faster and all the illnesses that we associate with aging, cancer and heart disease and dementia and so on. Work stress and aging, study in Finland. So people with high levels of workplace stress and burnout, about a decade older by middle age, compared to somebody who might be doing the same job, but coping with the stress better. It wasn't so much the job that was the cause of the stress, it was how the person was responding to the job or dealing with the job. Mind wandering and aging. And of course, this is a talk on mindfulness. So there's Elizabeth Blackburn and her team, and they looked at how much a person's mind tended to wander. Now, people with a low tendency for the mind to wander tend to have the longest telomeres, that is, are aging the slowest. And the more a person's mind tends to wander, the shorter the telomeres were. So just bear in mind, every time you're not paying attention during this presentation, you take another 5 minutes off your life expectancy, all right? So give me your very best attention. But what is it that the mind's doing more often than not when it's wandering? Well, it wanders into worry, negativity, rumination, and the rest. Now, I don't know if you ever feel like this fella here, but we do often have a lot on our plate. Now, so for health professionals, so the first studies looking at mindfulness training for health professionals were done on doctors. Ron Epstein in Rochester in the States published one of the first papers in JAMA. And what they found was that the doctors who learned mindfulness training, they became more mindful, more aware, more present, etc. But as the mindfulness went up on the scales, the burnout went down on the scales. As they became more mindful, they were more empathic and responsive to their patients, less mood disturbance, more conscientious about their work. So they weren't just turning up physically, but mentally being somewhere else. And much more engaged with their work, but much more emotionally stable. This is a review of 38 different studies on mindfulness-based interventions for healthcare professionals and healthcare professionals in training. And essentially, the studies show less anxiety, depression, distress, and stress, and overall small to moderate effects on burnout and well-being. Now, there are different kinds of mindfulness-based interventions. A more intensive one, like mindfulness-based stress reduction, seems to produce better results. So the more intensive the training, it seems to be, the better the outcomes. But even briefer trainings can produce significant benefits. This is the program we run for our students at Monash University. So, and I don't know if you're a bit the same, but in my experience of 32 years in medical education, you can't teach a medical student anything unless it's based on an acronym. And the acronym here, the essence of health, education, stress management, so that's the mindfulness, mind-body area, spirituality, exercise, nutrition, connectedness, and environment. So we teach the students by giving them lectures, the clinical relevance of all of these topics, mind, body, exercise, diet, etc. So we give them the series of lectures, and then they have a series of tutorials where they learn how to apply this stuff to themselves in their own life. And in learning how it applies to themselves, they're also starting to understand how they could help their patients one day. So now what we found was that in the mindfulness skills, by the end of the program, 90% of the students were saying they're actually using those skills in their day-to-day life on a regular basis. So this is core curriculum. This is not just a self-selected group, but 90% said, I'm personally using it to a greater or lesser extent. And what we also had done was measure their mental health and well-being prior to the program in a low stress period of semester. And then we measured their mental health and well-being after the program, but immediately prior to mid-year exams. Now, we should have seen increased depression, anxiety, we should have seen quality of life, crash and burn. We found the opposite of that. Everything we could measure about their mental health and well-being had significantly improved, despite the fact they're in the high stress period of semester. We used a bunch of scales, the DAS, the WHO quality of life scales, the symptom checklist 90. Every scale, every subscale moved in a positive direction. So we're very encouraged by that. Other studies too, I'll just briefly touch on them, studies on mindfulness in the brain. Sarah Lazar at Harvard University published some of the first studies in 2005, and there's been many dozens since then. And she was the first one to highlight that areas of grey matter thicken up as a person practices mindfulness. And that's just identifying some of the important areas. So, and especially in memory circuits, executive functioning, emotional regulation circuits. But the area that, of the brain that quietens down was the amygdala. So that's like turning down the volume on the stress response at the level of the amygdala. This is another Harvard study from Herbert Benson and his team. And what they found was when a person practices a technique like this, and mind you, they looked at it with not just mindfulness, but other forms of so-called relaxation exercises, what they found was that the genes, the segments of DNA that regulate the stress response were down-regulated. And it happens on the very first time a person practices this. But if a person only practices it once, it very quickly, the stress genes switch back on again. So this is epigenetic effects. But what they found was if a person practiced it again and again and again and again, then that down-regulation of the stress genes became deeper and more prolonged. So very interesting that it's turning down the stress response, even down to the DNA of the cells. I gave you all that bad news before. Here's another bit of good news, hopefully. Elizabeth Blackburn and team, this was the first of a series of studies they did to look at the impact of mindfulness on the telomerase, the repair enzyme, and what they found was that it switched on the telomerase and started to slow down the rate of aging at the level of the DNA of the cells. In fact, Elizabeth Blackburn and team did a study, it was on middle-aged men, and they found that if you combine mindfulness with some healthy lifestyle change like regular exercise and healthy diet, what they found was that over a 5-year period, they started to regrow telomeres. So that's on a genetic level, a reversal of the aging process, but I won't be talking about all those things tonight. But anyway, they're certainly very interested in these techniques. So practicing mindfulness, how do we practice it? Well, there are two main ways to practice it. There's the formal practice, and that's like sitting in a chair doing nothing other than being mindful for a few minutes. And then there's the informal practice, and that's being mindful while you're doing something. So if you're really listening to your patient while they're speaking to you, then that's the informal practice of mindfulness. If you're paying attention to the road while you're driving your car, then that's the informal practice of mindfulness. If you're tasting your food while you're eating, then that's the informal practice of mindfulness. So to be more able to pay attention in day-to-day life, a little bit of the so-called gym work for mindfulness, that is the formal practice, can be really, really helpful. Now, what I might do is, and this is not kind of a full-on workshop tonight, but what I thought I might do is just take you through a very brief mindfulness practice to get a sense of, how we can practice being mindful. So it'll just be for a couple of minutes, but we're going to practice paying attention for a couple of minutes in the present moment. So we've got to find something in the present moment to pay attention to. So we're going to use the body for that purpose. Main reason being that the body is always in the present moment. It's always here now. Like you never get to work in the morning and kind of go, where's my body? I haven't got it with me. Where did I leave it? Have to go home and get it. That's a good thing that the body is always with us. The body is always here and now, but the mind is often not. So to help the mind to be here and now, we're going to give it the body to pay attention to. And so we're going to use the body, and the body communicates with the world through the senses. So we're going to use one of the senses in particular, the sense of touch. So practice with me if you want to. Otherwise, just sit quietly and listen so you know what we are practicing. But if you do want to practice with me, then just sitting balanced now, finding a sort of a balanced position for the body. And this is not an exercise in tuning out. It's actually an exercise in tuning in. So just beginning with an overall awareness of the body and its posture. Just noticing how the body is feeling at the moment. And there's no particular expectations about how it should or shouldn't feel, just to simply be aware of it as it is. And there might be an awareness of the contact of the body and the seat that it's sitting on. Just an awareness of the feet on the floor. An awareness of the contact of the clothes on the skin. And one particular sensation that's always taking place is that of the breathing. So if you're happy to, without having to change the breathing or to interfere with it, just simply be in touch with the breath, just feeling the air as it enters and as it leaves, whether that's through the nose or the mouth. In the process of just feeling the breathing, you might also notice that the mind wanders from time to time. Thoughts come and go. The mind starts talking to itself about something or other. The mind could even start talking to itself about mindfulness. But whatever goes on in the mind, there's no need to judge or to criticize that, or even to think that it shouldn't have happened. Just practicing very gently, letting those thoughts come and go without having to do anything about them. Not even thinking they shouldn't be there. And if the attention wanders off, having noticed, very gently, in touch with the breath once again. Good. Good. So now just simply being aware of the whole of the body and its posture once again. And whenever you're ready, allowing the eyes to gently open. Good. We practiced that exercise then just for a few minutes. Now, what you might have noticed was there may have been awareness of the mind wandering, thoughts going off, coming back. There might have been a level of relaxation, or you might have just noticed the tensions that the body was carrying. Either way, we're practicing two main things. Firstly is attention, literally exercising the attention circuits in our brain when the attention wanders to come back. And the second thing is cultivating an attitude with which we pay attention, not judging or criticizing, etc., but just noticing and cultivate, even if we experience something we find uncomfortable. Could be a way of anxiety, just cultivating a gentle ability to just let it be there, to make space for it, to let it come and go without getting reactive to it, trying to fight it or suppress it, just learning to stand back from it, as it were, and just observe. So that's a taste of the formal practice of mindfulness. But the point is, why be mindful for 3 minutes sitting in a chair and then be unmindful for 23 hours and 57 minutes in the rest of the day? So the aim is to be mindful while we do things and live our day-to-day life. So mindfulness is not just a form of meditation. It's very much a way of living. So even studies, this was a study of university students, so just teaching them to wash the dishes mindfully. That is, when you're washing the dishes, just feel the water, feel the dish, hear the sounds. And it's interesting, when students wash the dishes mindfully, less negative mood, more positive mood, more enjoyment, the time passes more easily. And I used to find this, before I had training in mindfulness, I used to practice these kinds of things, especially when I was an intern. And if I had a 2-minute, one of those really long weekend shifts where you didn't get sleep for days, if I was walking from one ward to another, then just walk. And for me, that 2 minutes of just walking mindfully, just being with the rhythm of the body as it moves, was a kind of a mental rest, rather than feeling that 2-minute walk from one ward to another with another 2 minutes of rumination about how much stuff I've got to do and why I'm even doing this as a career. I think I might have chosen the wrong thing. I wish I wasn't here. When's this shift going to be over? I can't stand it, etc. Instead, walking mindfully became a simple, uncomplicated moment of the day, and then with a calmer, more attentive state of mind to engage in the next activity. Mindfulness for depression. I won't say too much about this. One of dozens of studies. This is just to illustrate the point. 106 people, multiple episodes of depression before, divided into 2 groups. One group gets treatment as usual, the other group gets treatment as usual, plus mindfulness-based cognitive therapy. And the red line's the relapse rate over the following year for the mindfulness group. So only a small proportion relapse into depression if they have mindfulness training. The blue line's treatment as usual. So by 12 months, more than half have had their next episode of depression. Now, the mindful group, it wasn't like, well, I never have any depressive thoughts anymore because I've learned mindfulness. No, it's more that if those depressive trains of thought came into the mind, they were more able to exercise a conscious choice. But do I want to get on that train? We don't have a choice necessarily over whether the thought arises. We have a choice over whether or not to engage with it or leave it alone, in which case we give our attention to something else, like the food we're eating, the person we're with, the car we're driving. So default networks, a lot of default mental activity in stress, anxiety, depression, etc. And studies of the brain show that when the attention re-engages back through the senses, the present moment, the default circuits switch off again, so the brain becomes quiet. And if a person practices regularly, areas of the brain associated with self-monitoring and cognitive control switch on much more quickly. That is, the person gets better at noticing when the attention's wandering off into something that's not helpful or just irrelevant, and cognitive control, more able to engage with what you want to engage with. All right, and I'll just mention this as the last thing before I finish. There's other stuff I could talk about, but it's I wanted to have some time for the Q&A. This is just looking at acute respiratory illnesses, mindfulness group, less illnesses. If they got an illness, far lower symptom severity and about a quarter of the number of days off work sick for the group that practice mindfulness. So it's reversing those kinds of negative impacts we were talking about before with allostatic load. All right, so the modern way of being connected doesn't look so connected to me, but that's perhaps where I'll stop now, because it's time that we have some questions and discussion. So what I might do is just stop sharing there for now, and come back and just turn on my video again, and be very happy to hear if there are any questions that anybody has got that you'd like to put. And Gemma, I think you've got a few questions that some of the participants have previously sent in.
I have indeed. Firstly, thank you, Craig. That was a really insightful presentation. You covered a lot of ground there in a very short space of time, including a bit of mindfulness practice there at the end. So thank you. Hi, everyone. My name's Gemma. I'm from the Alumni Engagement team. We're going to move swiftly into our Q&A session, and we have got a lot of questions, so we will try and get through as many as possible for the next sort of 15 minutes. A few questions around COVID-19, Craig, one from Anamika, who wants to know, how can we avoid loneliness and embrace the difficulties faced by others during these times without feeling overwhelmed?
Look, I think these are pretty testing times for any of us, really. And I think one of the things is that loneliness is significantly accentuated by wandering into all of that default mode, thinking where I'd rather be and where I'm not, and thinking back into the past and how nice that was and I'm not there now, and thinking, and the mind projects into a very dark future of what we imagine the future is going to be, and all of a sudden we're living in that world in our mind. So from a mindfulness perspective, it's like, all right, that those thoughts and feelings are there. So we learn to be a little bit more gentle on ourselves. We learn to feel a bit more comfortable with the fact that those feelings are there. We don't have to beat ourselves up over it, but we do cultivate our ability to come back to where we are, what is going on around us. And who knows, I mean, there may or may not be anybody in the house at the time, but there might be birds singing, there might be, the weather's very atmospheric, whether it's raining or whether it's not, but just getting that sense of the environment we're in, we might be able to, and this is one of the times when, although over use of technology and social media is getting in the way of actually connecting with people at the moment, I think it's bridging a really good gap. So connect with others, and I think face-to-face, things like Zoom and so on, and there's lots of others that are really a good way of doing that. So I think that if we can, to bridge there, and then to really engage our attention rather than rumination in things that we're interested in. So it's a good time, maybe there's a bit of space, and who knows, there's a silver lining there. But rather than spending the time ruminating, is to spend the time engaging the attention with things that are of interest and things that are creative and so on. And just, who knows, maybe 6 months, 5 years, 20 years from now, we'll really value this time because we had the space to maybe do some things, learn some things, develop some skills that might have been on the back burner for a long time. But certainly that default mode of rumination and worry is not at all helpful and can really accentuate that sense of loneliness.
Thank you. Another question is around, how do we apply mindfulness to eating, especially with emotional eating in times of stress, such as COVID-19? Something I think we can all.
Yeah. Well, look, to not be mindful, oftentimes when we're eating, we're just eating on automatic pilot. So we're not actually tasting the food, we're not smelling the food, we're not feeling the textures as we eat it and so on. And so we're just eating on automatic pilot again, while our mind is off somewhere else, wishing we're somewhere else, wishing things were other. And so we don't get the emotional enjoyment and satisfaction from the food, the same taste, etc. So to eat mindfully means to just connect through the senses with the experience of the eating. Right? So all of the senses could be involved. Even just the sense of sight, have fresh fruit in the morning and, kiwi gold, beautiful, and you're cutting it up and the color of it and the way the light hits it. But just simple moments of just connecting with the food that you're eating. But if we're on automatic pilot, especially if we're in default mode and ruminating, etc., and the kind of uncomfortable emotions that tends to produce in a very unconscious and habitual way, before we know where we are, the hands on the door of the fridge is open, and we just find the most calorie dense thing we can. We cut off a big slab of it, we eat it on automatic pilot, just go on to the next thing. So even if we are eating something that is a bit richer than we kind of would, from a mindfulness perspective, slow down and just taste the food. It is used, one of the areas that's been used with as mindful eating programs for, say, even things like eating disorders and bulimia and so on. But a really important part of that is to slow down the eating process and to do it with awareness. And when somebody does that, not only is there more enjoyment from the food, but also the person notices they're not feeding a whole stream of really negative self-talk and etc., which is quite common when people are eating in a very unmindful way.
Great, thank you. We've got another question from Mugara that wants to know, what activities do you recommend for healthcare workers to stay mentally healthy and calm while interacting with patients who have tested positive for COVID-19 and still need our care?
Yeah, look, I think one of the tricky things at the moment is that the real risk and the relative risk, sometimes, again, in our mind, we can see risks as bigger than they are. So we need to get a good idea on what the risks are, and we need to do what we can in a mindful way to avoid getting the infections if we can as well. But all of those things that we do to improve our mental health will also have a side effect of improving our resistance as well, should we be unfortunate enough to get infected as well. So certainly doing the job with attention is really, really important. So taking care, being mindful while we're doing procedures and so on, and we're putting our hands in contamination. So that's a part of what it means to be a mindful health professional as well. But not getting drawn again into the rumination or the worry about the future and what ifs and maybes, or going back over the past, etc. So I think that going about a really busy working life in a mindful way, I've found tremendously helpful. And part of that means during a day, you might do 100 things or 1,000 things, depending on what kind of day we're having. But if we're mindfully doing them, at any given moment, we're just doing one thing at a time, one job at a time, one step at a time. And so we step into a complex situation, clinical situation, give our full attention to that. But then you might have a minute or two of, again, it could be walking from one room to another. It could be, just finishing that, just a few notes. And we might just take a little mini meditation. So it might be 15 or 30 seconds before we go out and get the next patient. So we can have, not only be mindful, even in the mundane moments, just attend to one job at a time, one patient at a time, one moment at a time. If we do that, there'll be a level of calmness that'll run through the day, even amidst a really busy day, but punctuating our day with lots of little mindful moments in between. So if you practice for 3 minutes, 5 minutes, 10 minutes, you could call that a full stop punctuating your day. And I'd recommend maybe have a full stop before you head into your working day. So that might be 5 minutes of mindfulness meditation to help you move into the day mindfully. But again, at the end of your working day, and when you're going to move into whatever you do that evening, friends, family, or whatever it might be, then just have 5 minutes of mindfulness meditation at the end of the day as well. So it'll help you to kind of compartmentalize your life. There's work. Now you, in a sense, switch gears, make some mental space to now be ready to engage with family, for example. But during the day, between one patient and another, that little, and there wouldn't be a full stop, but it'd be a little comma. So punctuate your day with little commas. And it could be 15 seconds, could be 30 seconds, where you just complete what you've just been doing. Give yourself like just a few moments. Just be mindful. Touch with the breathing, for example, just noticing. Good. Now mindfully engage your attention with the next activity that awaits you, the next patient. And if we do that, again, we cultivate a state of mind that's more mindful when we're working, but also there'll be a level of calmness that'll run through the day, even in a very full day.
Thank you, Craig. Some really useful tips there. A question which I think a lot of parents would like the answer to. This has come from Maria. What strategies can families use to reduce worries around returning to school or existing home in regards to corona fears?
Yeah. Look, again, and for kids, I mean, from a health perspective, children, it's a very low risk thing for children, of course, but adults at school and so on, or the concerns in the community about the infection. But I think one of the important things for helping children to be less anxious and to be more mindful is what the parent is modeling. And of course, if the parent is modeling anxiety and getting way ahead of themselves and creating catastrophes out of thin air, I mean, it's enough to deal with the issues we have to deal with. Because we're mindful doesn't mean all the issues go away. They desperately need attention. But for every one situation that needs attention, we don't need to create another 1,000 in our mind in anticipation and worry, etc. So if, for example, the adults, if the parents, teachers around a child are modeling ways of being mindful and, engaging, dealing with problems moment by moment, not catastrophizing, etc., staying grounded, dealing with difficult emotions in a more mindful way. If that's being modeled for the children will pick that up and learn it quite quickly. One of my favorite studies I sometimes quote in educational contexts, talking at schools and so on, is that they did a study on children in early primary school, and they looked at their levels of maths anxiety and maths performance and how that correlated with their parents' maths anxiety and maths performance. Now, surprise, surprise, they found a very strong correlation between parental maths anxiety and children's maths anxiety, but only if the parent regularly helped the child with their maths homework. So if a parent was anxious about maths and not good at it, and they didn't help their child with their maths homework, the child was fine. And of course, the parent thought, I'm trying to help my child with the maths homework, when what they're actually doing was modeling how to be anxious about maths. And children pick that message up very, very quickly. So I guess coming back to the main point is the first thing is to be mindful with the child. So if you're practicing mindfulness, it'll help the child enormously. And then, of course, with your children, it can be an activity you can do. And the mindfulness with the kids is not just practicing some meditation, but it's also doing things, getting out into the garden and using every one of the senses to explore and investigate the garden. How many different shades of green? How many different flowers can you smell? How many different sounds can you hear? How many different insects are buzzing around and so on? So use the senses to really get into the natural environment. And so if you do things like that, you'll really be educating the kids in how to stay present and grounded and so on. And it can be a tremendously helpful thing to do. There's some really good, the Smiling Mind website or app is an excellent resource. And they're one of the top mindfulness apps in the world. And it's a Melbourne-based group. And it's a philanthropic group, so it's a free app. So I highly recommend Smiling Mind. Or from a mental health perspective in particular, the other top-ranked mindfulness app in the world is Headspace, the UK Headspace. But that's not a free app, but the Smiling Mind one certainly is. And they're two very excellent apps according to independent reviews. So I'd say explore that with your children as well. That'd be really helpful too.
Thank you, Craig. And probably our last sort of question now, as we're coming to the end of the session, there's been quite a few people asking about how do they fit mindfulness into their busy schedules, especially with the added pressure at the moment, and what sort of habits and practices do you think would be great to begin with?
Yeah, well, I guess perhaps I'll come back and reinforce a few of the things I was saying before. And there's two aspects to busyness. There's one, having a full life where plenty is going on, but then there's the internal busyness. And that internal busyness and pressure we generate from the overthinking things, thinking we're planning and preparing when we're actually just worrying, etc., and just going over and over things again in our mind. So there's nothing wrong with having a very full life, but coming back and just re-emphasize what I was saying before about one job at a time, one moment at a time, one conversation at a time, one job at a time. If we're trying to complex multitask and doing it all at the same time, not only will we make more errors and feel more pressure and stressed, and it'll impair our communication, etc., but we'll feel overburdened. And when we sit down to practice meditation, we'll notice how agitated the mind is. And it's kind of a bit of a window into the soul, really. So learning to live more mindfully and punctuating our day with 2 full stops at the start and the end of the working day, and lots of those little commas. And if you do that, that's my prescription for you. You've had a consultation with the doctor, so that's your prescription. 5 minutes of mindfulness to be taken seated twice a day before meals, right? And a PRN order for lots of little practices of meditation during the day, and just to be mindful as you go about your life. And if we do that, we can remain much calmer, but also much more productive and helping to prevent errors and so on, which are really, really important as well. So working more consciously and attentively. And I think that's the best way for long-term sustainable performance.
Thank you, Craig. Apologies to those people that submitted questions that we didn't get round to. Hopefully, though, we covered quite a lot in the ones that were asked to Craig. And just want to say thank you again to Craig for generously sharing his time and expertise. And also thank you to everyone that's joined us. We hope the session's been really valuable and helpful for those of you that are interested in more. Craig is a co-author of 2 free online mindfulness courses in collaboration with Monash University and Future Learn. And both of these courses are rated by Class Central as the leading online mindfulness courses in the world. So that's an incredible acknowledgement of Craig's contribution in this field. And you can find out more on Future Learn using the course links provided in the slide that you can see. At the completion of this webinar, Zoom viewers, you're going to be automatically directed to a short feedback survey, and YouTube viewers, the survey link will be provided in the chat box. It would be great if you could please complete that survey just so it helps us improve our future alumni engagement programs. And we also encourage you to join our faculty's alumni LinkedIn group. If you're not already a member, we'd love to keep in touch and also tell you about other upcoming opportunities with our alumni community. So once again, thank you for joining us. Please keep healthy, safe and mindful, and we look forward to seeing you again soon. Goodbye.